It's 4:40 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time for today's briefing from the South Korean health authorities. It looks like that's about to begin right now. Let's listen in.
And we will be hearing from Mr. Son Young-lee of the Central Disaster Management Headquarters, and we will be providing sign language translation. So first, Mr. Son Young-lee will be explaining about the countermeasures against COVID-19. I will start the regular briefing for September 5th. First of all, I'll give you an update for the first week of September. Starting from last Sunday to yesterday, Saturday, for the first week on September, on a daily average, there were 1671 newly confirmed cases. And compared to 1702 from the previous week, it is a 1.8% decrease. And for the reproduction rate, it is at 0.98, and it is lower than 1. However, it is not much lower than 1. So we believe that we are still at a risky situation. After the second week of August, for the past 3 weeks in a row, we have seen a decrease in the number of newly confirmed cases per day. However, we don't know if we have reached a peak yet. And just as a reference, 3 weeks ago on the second week of August, we have seen 1781 newly confirmed cases in a day. And for the metropolitan area and the non-metropolitan area, we're seeing a difference in terms of the trend. For the non-metropolitan area, we are seeing a decrease in the wave. And even for the regions that were at risk, we are seeing that they are stabilizing. And for the non-metropolitan area, there were 515 newly confirmed cases on a daily average, and this was a 12% decrease compared to the previous week. And if we were to compare this number to 703 from the second week of August, we can see that the overall trend is facing a downward trend. And by regions, we are seeing that we are seeing quite a great number still, and this is still at the second level of social distancing when we consider the social distancing measure, and we are seeing an overall decrease. However, for the Daejeon and the Chungcheong region, we are still seeing quite a high number, and for the Honam region, the number of newly confirmed cases is low. However, we saw an increasing trend last week. On the other end, for the metropolitan area, which is still the focus, we are seeing that there is a small increase in the infection, and we have seen that the number is 3.9% higher than that of the previous week. And if we were to compare it to the second week of August, which was at 1077, we are seeing the number is decreasing gradually. So for the trend itself, it is quite large in the metropolitan area, and it is still at an increasing trend. Therefore, we cannot sit at the laurels. And for the metropolitan area, please be aware that you can be infected anywhere at any time, and be careful at all times. And for the critically ill and for the case of deaths, we saw a slight decrease. There were 389 critically ill cases, and this was a reduction from the 417 from the previous week. And we saw 39 cases of deaths, and it was 74 from the previous week. We pay our respect and condolences to the deceased and the family members as well. For the critically ill and for the case of deaths, we are seeing a decrease in number. And together with the decrease in the overall infection, we believe that this is thanks to the vaccination of the elderly. So right now, with the expansion of vaccination, we believe that the number of critically ill will continue to decrease. The medical system is at a stable situation. So we still have 45% available for the ICU units. And for the livelihood treatment centers and for the hospital beds, we still have room, and we have more than 12,000 beds still available at hospitals. If the trend does not see an immediate increase, we believe that we will be able to maintain a stable level of available hospital beds. So in overall, we are seeing that the wave is facing a slight downward trend, and this is positive. And we still have a stable medical system in terms of its operation, and this is a positive outlook as well. However, we are still seeing quite a large number in the metropolitan area, and it is not decreasing, so this is still a risk to us. So it really depends on our ability to control the infection in the metropolitan area. Next, I will explain about the vaccines and the receipt of vaccines. On September 2nd and 3rd, we have received some Moderna vaccines, and we also received 1.5 million doses of vaccines, and it is planning to come into the Incheon airport later on today. And we're also going to get more than 2.5 million next week. And starting from August 20th, we have seen around 6.9 million doses coming in from Moderna. And in total, we have received 57 million doses of total vaccines, and we still have Pfizer vaccines coming in from countries like Romania. Therefore, we believe that those that are reserved for vaccination will be able to get vaccinated because we have sufficient amount. We don't have issues about the supply and demand of vaccines, so we do not believe that you should be concerned about it. And we want to ask you to actively participate in vaccination. The government will continue to strive hard to stably operate vaccines, and we believe that we will be able to achieve the target of 70% vaccination of our citizens by the end of October. Vaccination is going on smoothly. This morning, we have reached 30 million mark in the number of citizens that received the first dose of vaccination, and around 18 million has received even the second dose as well. And based on this, we believe that the government will be able to reach its target. Vaccination is important in preventing COVID-19, and we believe that its effect will show up starting at the end of September, and we have high anticipation for it. Dear citizens, starting tomorrow, we will be having a new social distancing measure being implemented for 4 weeks. And this is crucial for our measures against COVID-19 and our responses. This is not showing us that we can be relaxed. Therefore, considering that, we are going to be careful in mitigating some of the social distancing measures depending on vaccination. So we believe that we will have some expected effect that can come from vaccination. And we're also going to be easing some measures for the Chuseok holiday. So including the Chuseok holiday, if we can stabilize the wave during that time, we believe that we'll be able to ease social distancing measure in October, and that is what the government is planning for. So this adjustment in social distancing measure, we don't know whether it will be one that is too early in terms of mitigation, but that all depends on our effort. The government is hoping that it will become a preparation period for us to resume our daily lives, and we're also going to make efforts to make sure that we are supporting that. So we are continuing to make disease control measures, and at the same time, we hope that our citizens will do their best in practicing personal hygiene. Please make sure to practice personal hygiene, such as washing your hands frequently and putting your mask on. And please be especially more careful when you are in places where you inevitably have to take off your mask. The government will also strive hard to work together with you. Thank you.
네, 지금부터 질의응답 시간을 가지겠습니다. 브리핑은 사회적 거리.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time. Bye for now.